We've got a wonderful idea here for a clinical trial coming to our area thanks to Care Access. Joining us today to tell us more, Tyler Miller. He's a physician and scientist and director of patient access with Care Access. And we have Ada Ellerbrock. She's patient access liaison. And thank you both for joining us today.
Yes, thank you, Holly.
Thanks for having us.
Okay, so we had you guys on Noon Edition before because we were talking about the Alzheimer's study. And so, again, new opportunities coming. And Ada, this is a chance for people to get involved?
Absolutely. Yeah. Once again, thanks again for having us. Care Access is a company that runs clinical trials, and our mission is to increase access to clinical trials to communities that don't typically have the opportunity to be part of studies. So a year ago, Care Access opened at 825 West Market, right across the street from St. Rita's, with the goal to bring access to cutting-edge new therapies under investigational and clinical trials to all of Northwest Ohio. The first study we brought was a preventative Alzheimer's study. It used an investigational blood test from Eli Lilly and Company to identify people who were high at risk for developing Alzheimer's symptoms but didn't currently have any. And then for people who tested positive, they were invited to join part of a monoclonal antibody from Eli Lilly to see if they could delay or prevent Alzheimer's symptoms from occurring. The response we had was amazing. We had around 900 people that were able to participate in the blood test in Lima, one of the highest screening sites in the country. And then many of the participants were able to go into the investigational arm of the important study. Now, the study is closing in the next week or two, so if anyone still wants to participate, they can still sign up to be part of it, and they go to testforalz.com to be part of that. And then Tyler's here to talk more about a new study that's here to prevent heart attacks.
Right, Tyler, I mean, we think of the new year, people want to be healthier. They think about heart health with February and, of course, with the recent thing with the Buffalo Bills player. So what are you focusing on, that's different to try to help people, prevent heart attacks and strokes and the things that go with it?
Yeah, that's right. The next two studies that we just opened are exciting studies that are investigating a new way to try to prevent heart attacks. These studies focus on a different type of cholesterol called lipoprotein A, sometimes called LPA or LP(a), that scientists are finding is an important risk factor for cardiovascular disease.
And the issue is, I guess, right, they're not testing for that? Is that the deal?
Yeah, that's right. And most people have never actually heard of LPA. It's really similar to bad cholesterol, like your LDL, bad cholesterol, but it's even stickier than LDL and may likely cause blockages and blood clots in your arteries. And the people don't test for this because, and your physicians don't test for this, is because there aren't any current treatments that we have that are approved that reduce these levels. However, we know that these levels increase, like high levels of lipoprotein A increase your risk for heart attacks. And what's interesting about LPA, different from LDL, is that this level is mainly determined by genetics or the genes you get from your parents. And so people that have high LPA levels typically have them throughout their life. And that very high LPA levels can cause heart attacks in young or even healthy patients. And really, unfortunately, diet, exercise, other cardiovascular medicines like statins do very little to lower your lipoprotein A levels.
Okay, so we can help out if we would like and be involved in the study, and it starts out with a blood test, right? That's
right. Yeah, exactly. So, we have now new studies that are targeting lipoprotein A levels with investigational medications that are different than standard medications. These are new RNA-based therapeutics that are currently being tested in clinical trials. Some of these trials are testing whether these investigational medications that we know can lower lipoprotein A levels, if lowering those lipoprotein levels actually reduce your risk for heart attack, stroke, or other cardiovascular disease. And so people, if they want to participate and they want to learn their levels of their lipoprotein A, and we know that up to 20% of people can have high LPA levels, you can take a blood test today, no cost to you, to check your lipoprotein A levels and see if you qualify for one of these clinical trials that we have now open in Lima. And you can go to knowmylpa, knowmylpa.com, and sign up and learn more. Or go to our Care Access location at 825 West Market and talk to one of our staff members.
Wow, so this is exciting stuff, the people who want to get involved. And I assume the best target area is for people who have heart attack history, and that kind of thing within their family, because you mentioned genetics.
That's right. Yeah. So for folks who have a family history of heart attacks or other cardiovascular disease, for people who are older, over the age of 40, who are interested in learning about this, that's really who we're targeting with this test and these trials. But I think it's an interesting thing to talk about with your family and think about for your own family history of whether this is something you want to participate in.
Right. Yeah, very good. Okay. And thank you both very much for joining us today and telling us about this opportunity in our area.
No, thanks for having us.
Thank you.
All right. Thanks, Ada and Tyler. All right. Don't go away. New Tradition continues in a moment.